Welcome to Functional Roots, where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, and naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque, and into the powerful connections between oral health, the body, and the way we live.
So whether you're a fellow dental professional, a wellness enthusiast, or just someone curious about taking a more natural approach to your health, you are in the right place.
So grab your favorite herbal tea, settle in, and let's get to the root of it all.
Awesome.
All right.
It's like the perfect follow-up for our last podcast.
We are here with Dr. Kristen Geist, DDS, ABDSM, and Kristen has been practicing general dentistry for almost a decade. But during the last 7 years, she has been narrowing her focus to airway, sleep apnea, and adult laser tongue tie release. Several years ago, she was struggling with exhaustion, lightheadedness, anxiety, and trouble breathing before she was properly sleep tested and diagnosed with something called Upper Airway Resistance Syndrome, which is on the spectrum of sleep apnea. Now she works together with other providers to help those with sleep apnea, tongue ties, etc. feel their best. She lives in upstate New York with her husband, son, and 2 adorable rescue pups. She loves to spread awareness about the issue that things like sleep apnea and tongue ties can cause in adults and what signs to look for to see if you should be screened. I am very excited for this conversation. Also, I want to know about your dogs.
Yeah, I the dogs all day.
I know.
Thank you so much for having me. I'm excited too.
I think this is a perfect follow-up podcast. I think airway's definitely been far more on everybody's radar. I think Heather and I, just in the guests that we're talking to, the providers we're talking to, there's a lot more to it than the vast majority of providers, hygienists, dentists really think. I think in the last podcast episode, we discovered there's a difference between myofunctional, like tongue at rest and tongue at play. Didn't know that was a difference, but tongue ties play a whole different ball game in everything. So I'm going to stop talking and just start letting you talk a little bit more about your journey and how you got to where you're at. So thank you so much for spending time with us today.
Yeah, of course. I'm happy to. So I feel like a lot of us in the dental sleep airway world got here because of either ourselves, our kids, our spouse. There's usually a personal connection because we really don't learn this stuff in school, as frustrating as it is. Number one. And number two, when you start to see it in yourself or in your kids, you're like, oh my gosh, like you just can't unsee it. And then you just dive down the whole rabbit hole of learning and then you want to help everybody. So I think that's how a lot of us start, is through our own journeys. Myself, I was just starting out as a new dentist and I was exhausted. I was lightheaded. My office is very small and I could walk from my operatory to my front desk and be like I looked winded and my assistant would look at me and be like, are you okay? What is wrong with you? And I'm like, I don't know. I'd have headaches every day, the lightheadedness, the brain fog. I was having a hard time remembering things and it just didn't really make sense. And I felt like I would go to my doctor. I'd be like, I'm just really tired. I'm lightheaded. My anxiety was through the roof. And they're like, oh, sweetie, can you work on your stress? Let's go to more yoga. And I'm like, I'm doing all the things. I feel like I'm really working on my stress. And it just felt maybe I'm just not handling things as well as everybody else. I don't know, because there was no really answer. And so I just had to keep going and being like, I guess this is just how I am. And then I got really lucky. Sometimes things just line up. And I happened to go to a dental sleep course, literally because I wanted to visit my sister in Virginia. And as part of the course, I knew nothing about this. I just showed up. As part of the course, they wanted volunteers to take a sleep test. They already had enough people who snored or thought they had sleep apnea or knew they had sleep apnea. And basically we were learning the terminology and how to read and understand what the terms meant. We're not diagnosing things, but we need to understand. And they were like, we need one more person, like a normal sleeper. And I was like, oh, I don't want to sacrifice my good night of sleep in the hotel to take this sleep test, but fine. In the name of science, I'll take a sleep test. It wasn't a big deal. They've come a long way, but even then it wasn't, you're not strapped up like crazy for a home sleep test. And the next morning they printed it out and they were like, girl, you need to see somebody. You are not breathing. And I was like, what are you talking about? I sleep fine. And it was just like this light bulb moment because I never thought that this like younger, thinner, active woman would ever be considered to have sleep disordered breathing. But there I was, basically fragmenting my sleep 10 times an hour. And I was like, oh my gosh. So I printed it out and brought it to my pulmonologist and was like, help, what do I do? And he's, you know what? I'm actually seeing this a lot more. This was 10 years ago, so things have luckily changed, but I'm calling this kind of like the young fit female syndrome. You don't fit the mold of traditional sleep apnea, but your breathing is fragmenting your sleep. And I'm like, okay, but what do I do? I mean, you can try CPAP or you're a dentist, just make yourself an appliance. And I was like, huh? I have no idea what you're talking about. But he at least got me on the path. I couldn't find anybody to help me. So I was like, I guess what's the worst that can happen?
I got to learn it.
Like, I'll just figure it out. So you just start taking courses and watching webinars and trying to learn. And it's the traditional, wow, once I felt better, I can't be the only one. And then you just start to see the signs in the other people. But I just got really lucky because I had been to 6 doctors. I had been to urgent care. My oxygen was dropping. They thought I was having a pulmonary embolism. I went to the hospital. I literally had been seen by so many people, and not a single person ever really looked at what was happening during my sleep, which isn't uncommon, and it's very frustrating, but it's such an easy, non-invasive, like conservative thing to check. So when somebody's tired, why are we not checking their sleep? I don't know. But my journey is not uncommon. So yeah, so it was through my own struggle that I ended up.
So what are the common, like everybody thinks about sleep apnea as like the typical overweight, like thick neck. What are the typical signs and symptoms of airway restricted? And we're going to call it airway restricted because there's sleep apnea, and then you are diagnosed with something called upper airway resistance, correct? Can you maybe lay into what the difference between sleep apnea is and upper airway resistance? And then what are the typical symptoms that we can expect to see that are some of the red flags that people might not recognize?
Yeah, sure. So I want to just clear up some of the terminology first. Like an apnea means basically you're stopping breathing, which your oxygen's going to drop. Your heart's going to be going crazy. Your body's basically like gasping, right, to get that air. That's apnea. I picture like a faucet. If I turn the faucet on, water's coming through. That's healthy, normal breathing. Everything's coming through. I turn it off. That's an apnea. If I turn it on a little bit and there's drip, drip, that's hypopnea. And that is what's happening a lot in especially women. They're having these little episodes of like they're struggling to breathe, but it wasn't quite enough to count because maybe their oxygen didn't drop. But that struggle is fragmenting their sleep like crazy. And it's more a problem of the sleep fragmentation with my UARS people than apneas or oxygen dropping. So it's a little difference with the data that we're getting, but the sleep fragmentation is a problem for all of them. I would say the typical symptoms that we all hear of is like the snoring, the gasping or choking in the night, right? But a lot of women, it's more anxiety, depression, headaches, especially morning headaches, jaw pain, clenching and grinding, very common to clench and grind and just literally be trying to breathe and open your airway at night. Acid reflux is a huge one that is not talked about enough. High blood pressure, of course, mouth breathing, people waking up all the time to pee at night thinking, oh, I just have a tiny bladder. No, you might not be breathing. So those are some of the big ones, but I feel like it's definitely men more snoring and tired, women more generalized fatigue, brain fog, and clenching grinding issues is what I see more commonly.
Diving in a little bit with the peeing, I've had that conversation, like your bladder is supposed to shut off through the night. So if you are having that fragmented, it doesn't shut those physiologies off, right? Where then the bladder gets full and you wake up and have to pee a lot in the middle of the night. So naturally, we're supposed to shut that mechanism off so that we store or really don't even fill the bladder. But if you're constantly having to get up in the middle of the night, and this is why kids bedwet, right, as a symptom for kids with the same sort of symptoms. But in adults, I ask that question quite a bit when I'm screening people. One, you're waking up dry in the middle of the night. Are you clenching and grinding? Do you feel rested? And then I'm asking, do they get up to go to the bathroom quite a bit? Because that's another thing, right?
Yeah, and it's something that is really common, but isn't talked about, or people feel kind of funny about it. But once they know, oh, there's a reason and it's not my fault, it's not because I drank too much or like whatever, it's, oh, relief. Okay, there's a reason why I feel this way. So,
I think there is just like a lot of preconceived ideas about health literacy, right? What do people truly understand and know about conditions? Because just general knowledge is, oh, I guess I have a small bladder. This is something happens with age. Yeah, I drink too much caffeine. Any of those, people are so good at finding excuses, or it's just what they have been told their whole life. And we inherit that knowledge from our family of that's why. That is why you're having that condition and it's fine. Or it skips a generation, right? How many times have we heard that with cancer, diabetes, things like that? Oh, it skips a generation. I just have soft teeth, whatever, fill in the blank. So, same thing applies, but it is that health literacy. What can we do with that knowledge and how can we make that change?
yeah, absolutely.
So with upper airway resistance and sleep apnea, can you give like the targets? Even sleep apnea gets a little bit tricky. You don't technically have sleep apnea unless you meet a certain, you can stop breathing
Yeah.
15 times during the night, and that's not severe enough for treatment. How do you find the airway resistance? Because some of the doctors that I've talked to, does someone actually have to watch you during? I know. Okay, so how
So
does how
it's
do you treatment plan and categorize and then treat those two disorders differently?
so it's all a spectrum and it's all because of resistance somewhere, but that resistance could be nose on down, soft palate, tongue. Where are you having resistance? So it's so individual and there is nuance. So I'm going to try to not make this really annoying. But it is a spectrum. And the way I see it, things are only going to get flabbier and more collapsible as you age. So if I'm starting out at UARS, you better believe I'm going to end up with more mild to moderate sleep apnea in a few more years. So that's why if people have the signs and we can catch it early and make improvements early, we have a better long-term outcome. But with that spectrum, it's also important to know that there's a lot of night to night variability. So that's why, like, looking at your symptoms in addition to your scores and just understanding maybe a multi-night study is really helpful. What I've found is the traditional AHI, the apnea hypopnea index, is really good at catching the old fat man, right? But that
Mhm.
misses most women
Mhm.
because if I'm having all those fragmentations and all of that interruption with my breathing, but it's not bad enough to count, it doesn't count in that AHI if my oxygen didn't drop enough for long enough. So there's another score called the RDI, which includes these other respiratory effort related arousals, which is usually a score that catches more of those women with the less severe apneas. So if somebody's looking at just your AHI and no other data, we're missing a lot of people. And that's something I see all the time. People come in with a test and I'm like, you had all the symptoms and your RDI was high. That could have been diagnostic, but you were told you were fine. There's a lot of differences with who's reading the test, how it's being translated. And in my opinion, even if your score is really low, but you're highly symptomatic, absolutely. There's very easy things we can try to get you breathing better and sleeping better. Why wouldn't we do that? But the problem comes into play with, but insurance doesn't want to cover it because you're not bad enough. So we'd rather wait
No
not
insurance.
enough for insurance to cover it. So it's a whole cycle of problems with that piece of it. And that's why I'm really optimistic, though, as I start to meet more providers who are looking at more than just the one score, taking symptoms into account, doing multi night studies, because it does help people if we can get a true diagnosis, as annoying as that is. Because I don't want to just experiment with treatment that's going to cost them a few $1,000 if I can get it covered. So, unfortunately, there are those pieces to it. But yeah, it's such a spectrum.
So you could say that test misses the misses.
Yes,
Sorry,
like that.
I have been on like a Disney puns all week.
Like
I don't
making
know where it came from, but I was like, oh my gosh, it misses the misses.
It does. If you look at like the stop bang, which is like the traditional, like this is how you screen for sleep apnea, like every woman and anyone who's not deemed overweight is missed. That's why I'm like really working to help dentists just see here's some of the signs and primary cares and other providers I talk to too, because it's like not a big deal to get somebody screened. It's really not. It's not going to take you that much time to do a quick referral and it could change their life massively. So it's just the awareness is huge.
how do we find referrals? That's been one of my I'm connected with a couple of other practitioners in the space. So she's trying to build like a little bit of a grouping that you're a part of as well. But that's a challenge with bristle, right? I can see sometimes in the salivary test, which is how you and I met, is utilizing that. And oftentimes I'm like, okay, I think there's an airway issue. The test is telling me there's an airway issue. But then finding where to go. Where's the right sleep apnea? Are the home studies okay? Where do I find dentists who are treating? What of the different trainings that we should be looking at and therapies that we should be ideally looking for in patients if we do see these symptoms in our patients that we're suspecting?
Yeah. It is hard because there isn't like a standardized training, and we all come at this from different angles, whether it's expansion or we've learned oral appliance therapy or we've learned none of this. So my like cheat code for how to find the people is first find a local myofunctional therapist if you can. That's step one, because if you can find them, they've usually already done the work for you and they know the circle of people. They've found the ENT who's going to listen to you. They've found the airway dentist. So if you can find a myofunctional therapist, that's the cheat code because they've already made that circle. If you can't find a myofunctional therapist, I have a variety of directories that I share on Instagram a lot. The Breathe Institute is a great one. There's a variety of other ones. Also, my friend, Dr. Julia, who I think you know, Heather, Oris Wellness, she's created like a really cool thing that I think she's launching soon that is like a master list of directories. But I feel like generally starting with the Breathe Institute, because it's not just going to find you dentists, it's going to find you myofunctional therapists, dentists, ENTs, just people who generally have their eyeballs open to this.
Yeah.
And typically it's a good landing point, but the myofunctional therapist I feel like is just an amazing place to start because you can skip ahead and be like, okay, but who would you see?
That's usually what I try to do. That my first start is, I know there's probably an airway component. Let's find you a myofunctional therapist. I know I've talked to some other myofunctional therapists. You can schedule with me, anybody throughout the country. I'm like, I'm not super comfortable with that.
The local member.
Like, how are you going to connect them with someone to do the tongue tie release? Who are you connected to do, the ENTs? I like having someone somewhat local to the person so that they're interconnected with that community and they know who the good practitioners are to be referring to. So I love that you are on that same mindset that way.
Yeah. Also, just a side note for the sleep component referral part of it, I think a lot of people think they have to go through this whole process. You can self-refer to almost any sleep clinic, to almost any, even like the virtual sleep clinics. Like one of the companies I've worked with for people who don't live local to me is Sleep with 3 Eyes. You can self-refer. It works with medical insurances. They are state licensed people in your state doing a pre-test and a post-test review with you. They're not just like sending you a test and leaving you hanging. So that's why I don't love some of the sleep testing companies that are out there. But you don't need to go through this whole process. You can just self-refer because you have concerns. And it's usually, you have to check a box that you're tired, check a box maybe that you're clenching, grinding. And they're like, yeah, that makes sense that you need a sleep test. So it's not really a whole big thing because home sleep test is the standard of care. If you have signs of sleep apnea, it's really good at ruling it in. It's not great if you're symptomatic and it's not showing up. That's not where you stop. It can't rule it out. So if you're symptomatic and your home sleep test says you're normal or not a big deal, that's when you do have to do a little bit more digging because they underestimate things and there's night-to-night variability for the milder people. But just keep in mind, if you have concerns, you don't need to go through a whole process. Your primary care may have no idea. You can just self-refer.
Okay, interesting. I have someone I worked with up in Minnesota and he refused to wear his CPAP machine. And I was like,
I feel like most people do.
I said, talk to the one who gave it to you and see if there's someone in the area that can do other, like a mandibular advancement device or Vivos, or I don't know all of the different, but I'm like, maybe we can find something to at least try to open the airway and he went back and they were like, nope, it's just the CPAP. I was like, so basically they're said, use this or die. Because he had severe sleep apnea. I was like, there's no in between for this person. It's either use your CPAP machine or we're not giving you any other options that's not a good enough answer for me. You need to see somebody else.
It's
Mhm.
not, but I think there's a few layers there. One, you can't see what you don't know. You can't prescribe what you don't know. And I unfortunately think they just literally don't know. There are like
Yeah.
options out there that they don't
Yeah.
even exist. Like when I talk to physicians and I tell them I can lift and tighten someone's soft palate to get them breathing better. If they're not using a CPAP, they're like, that's a thing. Yeah, and it takes 5 minutes. Let's try something. But awareness is huge. So I think they don't know, or they don't know who to send to. But also, I lost my train of thought there. But yeah,
Do you think it's even like just being afraid to think outside of the box on how to treat just this is what I was taught, this is what is the tried and true, and just like being afraid to maybe do that crossover collaboration to look at another way to do it?
I do think that's a piece of it. And I remembered the other piece because when they give you a home test or any test in lab, there's like a list at the bottom of here's the 5 recommendations. It'll say try a CPAP, try an oral appliance, maybe get an ENT consult. That is on every sleep test that is I've ever seen in my life. And I've seen thousands. But nobody has read it to the patient. Nobody, like it's a standard thing on all these tests. And when people come to me for like their 10th opinion, I'm like, this was all on here, but nobody ever talked to you about it. So I think,
Yeah.
I don't know where the gap is. It's just because they don't have the connection. They don't know how to explain it maybe, but I don't know. I don't know what the answer is, but I think there's just a lack of awareness of, hey, we can all work together and make everyone's lives a lot easier.
I think there is a huge lack of awareness. They think dentist, they think teeth. They don't think oral. Like they think it just ends like
It's
right
just
here.
attached.
This, nope. Yeah, we don't know anything else. No, very similar. So I'm still a clinical hygienist. I work 3 days a week clinically, and I actually just had a myofunctional therapist come and do lunch and learn at my office. And I am the lone wolf in my office that is, we are way more. Let's do this. Like I have a new grad that is somewhat interested in airway. So he was open to it, but the rest of my office is just like, we scrape teeth, basically, a thing. So I would love to hear your like workflow and how you have your team looking at airway and how you're going about having conversations with patients. Maybe they don't come to you, but maybe you are noticing like signs and symptoms in a patient, having that conversation versus the patient aware and coming to you.
Yeah. I wanted my hygienist to first understand why this was important. So I offered to sleep test all of them and their spouses. And that's where we started. And let me tell you, when you realize that your spouse who's had a heart attack is actually stopping breathing 50 times an hour on average, you realize that perhaps this is important. And we had that happen with themselves, with their significant others.
Wow.
And so before we even did training, I did a very surface level lunch and learn just to say, hey, this is important to me because of my journey. We actually have a really cool opportunity here to help people, but I want you guys to understand it. So we tested them, whoever was open to it, which was actually a lot of them. And then once they got tested, and then it was like, oh my gosh, but what do we do? How do we help? They realized like, I have all this spare time while I'm waiting for my doctor to come into the room. You know what? I could just bring this up with somebody and say, hey, I noticed you checked off that you snore, you clench and grind, you have high blood pressure and diabetes and whatever. Has anyone ever mentioned sleep testing to you? And it can be a very low risk conversation. It can be very simple. You don't have to feel very pressured. But we just basically had the understanding of just if you notice these red flags, just start a conversation. And if you don't feel comfy, just point it to me. So when I walk in, I start the conversation. And just having it be very like, our role is to screen. We are not responsible for if somebody follows through. And because I would get very frustrated at first because people would be like, I don't care, just clean. And just understanding we are responsible for screening. We can let people know what we find and what we recommend. It's up to them what they want to do with it. And then just taking the pressure off. And then once the pressure was gone, people were just starting conversations. And usually nobody would do anything with it that first time. But then the 6-month follow-up, the year follow-up, they're like, what was that thing that you said I should do to help with my snoring? Because I have a girls' trip coming up and I'm embarrassed. And it usually was like that seed was planted a year ago. And now there's some reason, or my doctor told me that it might help me lose weight if I can sleep better. There's usually some sort of like a reason, but we've already planted that seed.
Yep.
So now they're open to it. So I think just having my hygienist feel empowered that you are absolutely capable of having these conversations. You know what you're doing. you're not diagnosing anything. It's just like taking their blood pressure and saying, oh, it's high, go see somebody. Like, we're seeing the signs, we're referring you to see somebody.
It's helping connect the dots.
Yeah, exactly. So I think just opening that up, and like on our medical history form, we just had the highlighted one that was like, these are the things. If there's one of these and any of these, you're going to start a conversation. Just like very easy, very simple. It didn't need to be this whole complicated and extra form. We added no extra forms.
So
That's
one of
nice.
these and few of these, let's dive into it. So one of the things that what I teach with the bristle people who are testing, I see a lot of times that low nitric oxide score is a red flag for me in the bristle test. So that's my immediate, are you overusing antimicrobials? If we're not, we probably have some sort of airway thing going on. The halitosis score will have a tongue coater nature sometimes. That's a big red flag for me, is that tongue coating. And then I have some stuff in the back side of the test results that you and I have had conversations that are usually the postnasal drippy stuff. If we have sinus issues, that's another thing. Inflamed tonsils. There's tonsil stones. These are the things that I try to teach the bristle people, but even Mallampati score. I don't know how many people I have conversations that like, I see these symptoms in the test and it's crazy. Yes, the oral microbiome can tell us so much. But then I'm like, okay, what was the Mallampati score? And then like, I have no idea what that is. Just what are some of the things that you're talking about? I think of blood pressure, cardiovascular, acid reflux, clenching and grinding in the health history are like my big anxiety and depressants. If someone has ADHD, those are some other things that I see in health history. I'm like, okay, let's start putting that puzzle piece together. Or inflammation in the mouth where we don't have the typical pathology in the test, like the gum inflammation score will be 0, the nitric oxide score will be 0. And then I'm like, but we have inflammation. So let's talk about airway.
It's like some of the simplest things that are the red flags for us. Like we have one little section that's like our, like, these are the big ones. And then we look more, but like
Yeah.
same thing. Like, of course there's the snoring. Are you tired? And then honestly, dry mouth, because that starts the conversation of, but why is it dry? It might not be like a salivary issue. It's usually mouth breathing. So it's the dry mouth is honestly one of our biggest ones. And that's when we can lead into some of those other things like the tongue scraping and the nasal breathing and all of that. And then the clenching and grinding. So there's like those big ones. And then we're tying it to, oh, they're on high blood pressure medication. Oh, they're on XYZ. So I'm looking at some like really basic things as the, oh my gosh, don't miss these. And then we're comparing, oh, they're on anxiety medication, depression medication, all of that.
My airway learning and how I got so passionate about airway is I worked for a dentist and his brother-in-law died in his sleep. And he had young kids. I think they were like 8, 10 years old. His wife had to give him CPR. He knew, like, we knew he had sleep apnea issues. He refused to use a CPAP machine. So from that point forward, my mom is severe sleep apnea and she lays down. She's not even sleeping and she's snoring. And I was like, you have to get a CPAP machine or you're going to die. So I get tough with people and they're telling me that if they're snoring, you should definitely get a sleep study. If you're snoring, that's a sign of airway issues. And if you have sleep apnea, you can have, and your heart stops when you stop breathing, you could die. But that was like early into my career learning that. But at that time, there wasn't a lot of information on myofunctional therapy. I had no idea until I got into more functional dentistry. I had no idea what a myofunctional therapist was until I got into the biologic side of things. Never heard of it. So there's so much more to teach. I wish that the dental schools and I wish that hygiene school taught Mallampati score. And I
feel
wish
like
we were teaching how to catch it in kids.
that I know it's hard because we keep trying to go back, but how do we like stop the bleed here? Because we need to go back a few years. And that's why I'm really working on not doing individual consults as much and doing like training the professionals. And I'm going to talk at our local hygiene school soon to just be like, hey, here's some like screening stuff. And I try to put out stuff for dentists too, of just like, here's how to screen. Like you have no need to treat it, just like you need to know how to screen. And that collaborative that we're involved with, like other professionals can screen for this, and it's super easy. So just like getting the information out there, getting kids on it. Oh, it's huge. But like a lot of us as adults now have so much more work to do because that wasn't really a thing when we were kids. And like I just watched my husband go through maxillomandibular advancement surgery. That was a major surgery, but he was dying in his sleep every night. And perhaps if we had intervened when he was 3, 4, 5, maybe it wouldn't have been necessary. And that's why I get frustrated when people are like, but it's so expensive to intervene early. Yeah, it is. What's also expensive? $80,000 jaw surgery. Thank God for insurance. And it's cost you time, money, effort, could cost you your life if you have a heart attack, strokes. Yeah, it costs a little bit of money on the front end, but you're saving yourself so much in the long term.
Yeah.
It's cheaper than braces,
Way cheaper.
but people will fork out to have straight teeth.
Yeah.
It's wild. Okay, I have a random question that I just thought of. So Mallampati score, I think for anybody that doesn't know, basically is like, how big is that airway? Like you stick your tongue out and how much of your airway do you see? So it's 1, 2, 3, and 4. How much space is there, to put it quickly? How much does the Mallampati score matter if we're supposed to be nasal breathing?
So it's interesting you say that, because at the last conference I was at last month in Vegas, Dr. Zaghi from the Breathe Institute was saying that he's actually, I think, taking that off of the Ferrist screener because it wasn't as predictive. But in my mind, the air's got to still go through there, like nose behind. So I think that when I'm looking in someone's throat, and I keep it very simplistic, if I don't see any blank space, if I just see like tongue, roof of your mouth, nose base, not ideal. So that's where I'm like, if we can make a little improvement there with conservative things like laser, maybe weight loss, if that's a potential thing, but not for everybody, why wouldn't we try? But I have people all the time where like I could park a truck back there. There is so much space, but they are still like not breathing. So it's a piece of the puzzle. It's not the whole puzzle. I think it's important when we're staring down airways all day, every day as hygienists and as dentists. Important to just look a little past the teeth. What's going on with those tonsils? Can you see any airspace back there? Because that's where you do get some information. I think it's an important piece, but it's not, oh my God, there's no space. You have a problem. Because if we start sending every person that has Mallampati or has tongue scalloping for evals, I think our docs are not going to love us. So you've got to have, I noticed this intraorally, but also XYZ, I think is a better place to start personally.
Yeah, interesting. Thank you. Thank you.
So what are some of the treatments? I know I struggled. I would love my husband to go through this entire process because he snores. He has basically end on bite, and then laterals are like lingual version. He just does not have, his tongue cannot go to the roof of his mouth whatsoever. My kids are the same way. My oldest one has tori. All I can see is her airway when she talks to me sometimes. So I wish I knew what I knew. She was the kid that we pulled everything out to get everything to come in, but no one ever offered any type of expansion. Even though I had her in an ortho evaluation at the age of 6 because she was so crowded, they never offered expansion, which drives me crazy to this day. But she's tongue-tied, like all the symptoms, attention deficit, everything that you could think of, she's airway. So now I need to get a myofunctional therapist. Eventually, that's what I plan to do after this. I'm getting the saliva sluice community up and rolling, but I want to do that in the worst way. But what are some of the things that we can treat for adults? What are some good options? I know I've heard of Vivos, I've heard of MARPI. There's all kinds of different procedures now for palatal expansion. Some are affixed to the teeth, some are with implants on the palate that expand. What's the best options for us when we have such a crowded upper maxillary that we do need to gain some space, not just moving the teeth in the bone, but actually palatal expansion?
I think it's important if somebody's like sleep tested to have a good diagnosis of at least like where we think the obstruction's happening, right? Because you can expand all day, but if you can't breathe through your nose holes, forget about it. So you've got to make sure that's clear, good ENT consult, good nasal hygiene routine. But yes, of course, the roof of the mouth is the floor of the nose. So if we can flatten that out, you're going to have better breathing space, which is why I'm finally about to go through adult expansion myself, because I'm pretty narrow. But there are a lot of options. So for some people, depending on what chapter of your life you're in, maybe you have young kids, a CPAP or an oral appliance might make sense for you in that phase of your life. Those are crutches. They can help keep your airway open while you're sleeping. But changing the anatomy. So yes, expansion, there are different options. It's really going to depend on if getting more expansion for you and your tongue getting up is going to solve the whole problem for you. So I guess getting some imaging and getting a good diagnosis there is important. But so MARPI is the one where you're putting up basically adult palatal expander in the roof of your mouth and using either traditional orthodontics or Invisalign to scooch the teeth around after. Vivos is a little bit of a different process because it's a removable appliance. People really like it. I just personally am going MARPI because I know myself and I'll just take it out and it won't work. So there's like different reasons lifestyle wise that you have to consider too. There's some other things out there too. I see ads all the time for the Excite OSA, and it's basically doing what Mayo is doing to like tone up your tongue. So there's things we can do to improve your tongue posture, like myofunctional therapy. If it's tied down, you're going to be more prone to mouth breathing, right? Versus if it can go up, you will breathe through your nose. Getting the tongue figured out is key. Sometimes for that soft palate, like I was saying, we can just use a laser, tighten it up a little bit. That can be a game changer for people. Weight loss can be a part of it for some people, not for everyone. So that is sometimes a factor. Positional therapy. The options are really endless, but in my opinion, it's usually a combination of a couple of things. And some of the biggest game changers are like the simplest things. Hey, have you tried a nasal strip or a nasal dilator to open up your nose holes when you're sleeping? Perhaps we could do that and sleep on our side. Like sometimes it's like the simplest of things. Or are you allergic to dogs and do you have 3 dogs in your bed at night? Perhaps that's why we can't breathe. Like sometimes it's really simple things and we don't need this whole like crazy surgery. So just like talking to people, what's your house like? What's in your bedroom? Could we add in an air purifier? Could we maybe rip up that old carpeting that was what in it? Sometimes it's things that are not like you need jaw surgery. Sometimes it's just what's your home what's going on in your life.
Yeah.
So it's a range.
I just love that you said nose holes first off, but can we talk about nasal hygiene? Because that's definitely not something that is talked about. What do you recommend to clean? Because obviously we don't want to go crazy and kill everything up there, right? There's still good stuff. What is something that you recommend?
What I like and what most of the ENTs I've worked with have felt comfortable with is I use like a NeilMed sinus rinse bottle. I do not do it every day unless I'm like really congested. I'll do it maybe like once a week if I remember, unless I'm feeling stuffy. So sinus rinse here and there with distilled water and the little packets they give you. Xlear spray is the one that I like because it has xylitol in it. I don't do it every day. I probably should do it every night, but most days. Honestly, again, really simple, but can you do some alternate nostril breathing? That's going to clear things up a little bit for you. Sometimes it's just really simple things that don't take you too long. I love just like a steam shower before bed with like eucalyptus spray and just like breathe little things. And I sleep with a dilator every night. I have a deviated septum, but it wasn't like enough to like warrant surgery. So for me, just having something to support my nose.
What do you feel about colloidal silver sprays?
I don't know enough about that,
Okay.
honestly, to have a good answer for that.
Okay. Heather, you might also know this. Are there like probiotics for your sinuses? Is that a thing?
I don't know. I haven't seen, I know I have, it's not a probiotic, and it's not for your sinuses, but there's a Problis throat spray that's
I have that one.
if I'm seeing a lot of the postnasal drippy stuff and they're talking about their tonsils it's Propolis, which is immune building and antimicrobial, and it has some zinc in it and some good stuff that way. I love Xclear too. The colloidal silver, I have used when I've had colds and stuff. One of the things that I try to tell people is we have to use our nose. I used to mouth breathe. And then at nighttime, I started making sure that I was breathing through my nose by figuring out how to breathe through my nose. Even when I have the worst cold ever, if I spend before I go to bed 10 minutes really focusing on nasal breathing, it clears up and I can breathe through my nose the entire night, even with the worst head cold. What's that?
Also,
I know we're all what?
I have this with me because in my basement, I tend to get stuffy. We moved and there's something going on down here. The boomstick, like the nasal inhaler sticks.
Boomstick.
Now, have you tried these?
No.
No.
Oh my gosh, I wish I could let you sniff this through the screen.
Give us a description. Give us a
Okay.
visual.
Okay, so here you go. They're just different. So this is just like a minty, like eucalyptus peppermint
Oh,
smelling stick. So I keep one at work. I keep one at home before bed. It just opens you right up. There's other scents to them, but the mint obviously just feels really nice because it opens you up before a yoga class, before a massage. Anytime you're going to be like dripping or whatever,
yes.
it feels really nice. So I like to do this before bed. I also, in the dental operatory, keep one because if anyone's feeling a little faint, this is a heck of a lot nicer to smell than ammonia. And I'll just put this under someone's nose or for mid tongue tie and someone's feeling a little nervous. These things are amazing. Yes. Boom.
I'm gonna have to get some
I
of those
know.
for the shelf to. I'd use like essential oils with like peppermint or eucalyptus, just like a little bit on your hands or the breathe, and then just cupping, and it would be something similar to that.
Like
Maybe
on your skin. It's not like getting it at all. It's just you're just breathing it in and
just
it
breathing
right
it.
up. So if you have a cold, you can do this and then do a little alternate nostril, and it's so much better because I know it sucks when you're trying to sleep and you just can't.
Yeah.
I love these things.
Awesome. I have that tagged as a
Put it in your cart.
and another window open in my computer.
Yeah. Multiple windows. Okay. That was such a great segue. I really do love that. With the Heather asked this question a while back. We always talk about expansion being genius, but what about the mandible on the opposite side of it? I don't think I've ever heard anybody talk about mandibular expansion, only palatal to open airway, but obviously we still have to pay attention to occlusion.
Yeah, so I am not an orthodontist, so I'm sure somebody can answer this much better than me, but I have seen the people who are doing it on like young kids, they are able to get some expansion. So they say on the mandible, but otherwise for adults, it seems like it's more just like tooth movement to accommodate. I don't have the best answer because that's been definitely a concern of mine too, but it seems like once we make the room on the roof of the mouth and the tongue just floats up better, if we can make the teeth work, we may have limitations with how much expansion we can do.
Yeah.
You don't want your teeth like tipping. So definitely a factor for adults. It's a little more limited, but for kids, it seems like we can guide the growth and development a decent amount. But again, I'm not the expert there. That's just what I'm seeing.
Yeah, I was
You're
I was
in the
wondering that.
conversation.
I remember sitting in a restaurant maybe like a year ago, and obviously the kid had been in expansion. And I was watching him eat from across the way, and the hygienist in me was like, whoa, someone way overexpanded that kid. I don't know how he's chewing because it looked like his lower jaw was like inside his upper. And I was just like, how is that going to work for him at this point? I don't know. So then when I think about the adult expansion, I think about like when people are talking about we expanded 7 millimeters or something going to the IOMT, they've talked about it. I think about how the occlusion works on the mandible and how does that all come together. Me personally, like I feel like I'm retrognathic, right? I feel like my mouth would be much more comfortable if my jaw could move forward. So I feel like that forward ability to pull my jaw forward would maybe correct if I expand. So I feel like sometimes the puzzle piece might fit depending.
Yeah, I'm sure once they do their like scans and measurements, they can tell like how much
they can do.
The teeth, but it's definitely more limited with adults.
Yeah.
With what we can accomplish.
But it can make a difference. Yeah.
Well, no, I'll find out soon.
And you're doing the MARPE.
Yeah.
Yeah. And is it a surgeon that places the MARPE?
Yes. So the oral surgeon who did my husband's MMA surgery will put the MARPE in, and then my orthodontist he's really good with MARPEs. So he's going to help me on that side of it.
And then are you doing your traditional ortho or are you doing Invisalign?
That was the plan, but he's starting to do more than Invisalign after. So I think we might actually get to do Invisalign. So I'm excited to not have.
Okay, knowing what you said earlier about you not wearing appliances, are you
I
actually
know.
going to wear them?
I know.
That's
I
my
feel like
clinician self. I'm calling out
hard.
patients.
I have mixed feelings on Invisalign just because I've had it twice. And obviously, I'm an airway patient. I have a mid tongue. I need to come see you. I have a tongue tie and everything went back, but my bite has been messed up ever since having it because I feel like when you have millimeters of plastic in between the teeth, is your occlusion ever really good with that? So I tend to be like, I don't know, a believer in like traditional ortho where the teeth can be in occlusion and then you can move things and actually see how, I don't know. What's your feeling on that?
I guess I'll keep you posted because I've only ever had traditional ortho. I've had braces for 4 years. So we'll see. I don't really know. They'll be the experts on that. They do a ton of Invisalign and I feel like they have really good results with the occlusion. So I feel like if that was a problem, it wouldn't be as popular. I'm also like the total weirdo in the dental world that like everyone's so focused on the occlusion and I'm like, but your teeth shouldn't be together that much. Why are we freaking out? Like I was at a study club last night.
Valid.
Man, everyone's gonna hate me. Everything's like about
Be that person.
that's dysfunctional if your teeth are together more than 1% of the day. What's happening?
That's
So,
valid. That's so valid. Like it's just chewing function, right?
chewing.
You're not a typodont.
No. So yeah, I don't know. I'm probably gonna get kicked out, but we'll see.
Good on you.
Out of the study club.
Good on you.
That's
funny.
awesome.
Sorry, my own like dental journey. I don't deserve the teeth and the anatomy I have. I did braces once because number 7 is shorter than number 10. Obviously didn't know what those numbers were when I was a kid, but I was just like, I just want that fixed. I think traditional 2-year braces, they gave the wire retainer. I was like, I'm never wearing this stupid thing. And I think my teeth like moved out a little bit, but I have like probably a 2 millimeter overbite. No, overjet, excuse me. Sorry, overjet. So my front teeth, like even with clenching grinding during hygiene school, there's no wear facets on my front teeth. There's nothing there. Off to the side though, yes. But when I never understood though, why could I get away? This is what made me ask the question and what made me believe in myofunctional therapy when I finally heard it. Because I was never going to wear a super retainer a day in my life. Like maybe I had whitening trays. Maybe I had the whatever we made in hygiene school as a night guard for a while, but I never wore any of that. So lips and tongues being natural retainers made sense to me. I'm like, okay, I had a decent enough airway. I don't have enough of a tongue tie. I haven't worn a retainer since I was 18 years old, and I am going on 42 this year.
And I'm the opposite. Like my teeth automatically come in, and sometimes at night I'm like, loosen your lips, girl. Like your lips. I'm like, against your teeth, and my tongue's not there to counteract it.
You have do you have lip ties?
I don't know. I just think like my facial posture sometimes I'm just like,
I can touch my nose with my tongue.
Oh, wow.
Like,
see, your tongue protected you all these years.
I didn't even know.
Yeah.
Never
Yeah.
did I know. But
Yeah.
so funny. It's just so funny that like the little things, like my husband and I were like making tongue shapes the other night. And I was like, you know, this is good. We're doing all of those things.
I love it. Like, I'm gonna sleep better if I keep doing this.
Yeah. Can you take a drink when you do that? And not, and not spew water everywhere?
I'm telling you, doing myofunctional therapy as an adult was real humbling because it's like me and then the waiting room full of babies and they're watching me do swallow food. And I'm like, oh my gosh, I never really realized all the things I'm doing. Yeah, but it was a good experience.
Do you have a myofunctional therapist in your office? No.
No, not in my office, but I have 2 locally, which is awesome. Now, it took a little while.
Yeah. Awesome.
Can we switch conversation to tongue ties and lasers?
Sure.
Heck yeah. Okay. Heather, do you want to guide the conversation on tongue ties? I know you've already looked up all the things to ask.
Oh, I put on the spot.
Do you want me to just talk?
You can just talk.
There's different tongue ties. We talked a little bit about that. There's the typical, when I look at my 24-year-old, she's going to be 25. Like I can see like It's like I can see
How was that?
thing.
I
And I'm
like
just like,
sound of
it's staring at me. But then I have a mid-tongue tie. Like I can stick my tongue out, no problem. But the backside of my tongue
like
doesn't
the
come out.
suction hold or something. Can you,
Yeah,
if you were to click?
I can't suction for no.
Yeah. So
It's so hard. It just like curls up in the
Huh.
center.
That's so wild.
in kids, there's of course, like we just talked about, like it's nature's palate expander, and there's a lot we could talk about with kids. But since my realm is more adults, I would say for adults, the problems I see are if your tongue just literally can't get up to that easy posture on the roof of your mouth. Like I said, if your tongue is stuck down, you're going to be more prone to mouth breathing just naturally, which is going to have a whole ripple effect, as we know. But also just jaw pain wise, because if you think about it, if your tongue can't independently move to clean off your teeth, you're going to be more prone to cavities. If you can't independently move your tongue to speak, to chew, to swallow, your whole jaw is going with it every time you're moving. That is exhausting. And typically for adults, I'm seeing jaw pain, neck tension, the clenching. It's less of the like nighttime grinding, it's like the daytime clenching, because every time you swallow, your teeth have to squeeze together 2,000 times a day just to get your tongue up to swallow. So you're not even trying to, you're not stressed. You just literally are trying to eat and swallow. So that's a really common one if your tongue can't make that movement. With adults, it's funny because all I can promise with a tongue tie release is more mobility of your tongue. The goal being your tongue being able to get up to the roof of your mouth for better swallowing, breathing, all those things. But the ripple effects of things people tell me after, like it blows my mind every time. And I never make any promises, but people come back being like, I don't get headaches anymore. Or I used to have PT for my shoulder, or I'd plantar fasciitis, or I'm like, oh my gosh, that's amazing. I had a singer yesterday. She's like, my vocal range is way better and I don't get fatigued anymore when I'm singing. I'm like, cool. I can't promise any of those things, but it's so nuts that fascia and that tension, what that can cause, the forward head posture. And once, like, literally, I had one after we released his tongue. His wife was like, "You're like, seem taller." His posture was better. He just literally stood up taller after. It's just really cool. So, with adult tongue ties, there's so many things, but one of the biggest other things I've noticed is anxiety. So we know that the tongue up on the roof of the mouth stimulates the vagus nerve, which is putting you more into that parasympathetic rest and digest mode. And if your tongue can't do that, and your mouth breathing, you're going to be more in that like fight or flight hypervigilant mode. So that's been a really fun thing when people come back and they're like, I don't know how to explain it, but I just feel more calm. I just feel less anxious. And I'm like, I can explain it, but I never want to promise that to somebody. It's just been a really cool side effect to see once you can better nasal breathe and get your tongue up. Huge difference.
So just the use of, I'm assuming your laser reduce. Do you have a photona?
No, I use light scalpel,
Okay, all right.
CO2 laser. Yeah.
So they have a similar. I'm familiar with night laser treatment with the photona. I'm assuming that's the similar thing when you said you're toning the tissue in the back, where you're treating with the laser in the backside of to bring that tissue up, right?
Yeah, it causes that collagen to contract and lift. The light scalpel is super cool. It's a newer thing out there with light scalpel, but it takes 5 minutes instead of 45 minutes, and it's usually 1 or 2 sessions instead of 5. So we're trying to spread the word that this is a thing because it's like such a low risk, non-invasive thing to try. So if people already have this laser, just get the other tip for it. And it basically is doing what night laser does, but with no downtime and much faster.
Yeah, a fraction of the chair time too. 45 minutes versus 5 minutes. That's significant.
Yeah, that's crazy. So do you also treat the floor of the mouth to help with myofunctional therapy to tone and assist through the myofunctional therapy to get the best release possible?
You're just so smart. You're just so smart. So that's where we're headed, actually. Me personally, I've done the soft palate laser only for about a year. And I just was at the Breathe and Thrive conference in Vegas last month, and I was talking about it. And one of the other doctors there is using the laser to shrink up. He's doing the sides of the tongue and the floor of the mouth. So he's treating all those areas and he's having really good results. He's not, I would say, doing it in terms of if they have a tongue tie, it's just generally to make more space. So that's something that I'm like in experimental phase with people, but not something that I'm doing as like a everyday thing. Yeah.
It's interesting. So again, going back to my airway, I do have some scalloping on the side. Like I'm probably like a Mallampati 3, but great mouth breather, or excuse me, nasal breather, not mouth breather. Sorry.
Watch out.
I know. It's like, don't come in my mouth. But I was just like, I was thinking like that would be something interesting to try on myself to see. So obviously the tongue is muscle, and you were saying it's collagen on the roof of your mouth. So what is it, muscle then that's shrinking on the tongue?
So the CO2 laser targets the water. So I'm not sure exactly how that would be working with the shrinkage, but I would imagine I'm thinking of, yes, of course, the collagen for the roof of the mouth, but I'm wondering how that, if it's causing muscle contraction too. I don't know. I'll have to look into that more. But I was just thinking of like the thing I use on my face, like the microcurrent thing on my face. I was like, oh, could we use that?
I wonder if it has anything to do with the fascia there,
a
though.
second.
The fascia is going to be similar, right?
The
That's
fascia.
gonna be-
The water content.
yeah.
Yeah.
I wonder if it's
Interesting.
working on the fascia release in that component too.
I feel like the whole fascia conversation is finally becoming, well, more on my Instagram feed and just a conversation in general that I'm seeing from a lot of like just functional moving people. The ones that it's not about just working out, it's like how functional is your body and getting every little possible like inhibition in that fascia to be functional. So yeah, head to toe release. I think I've seen one, I think she's a PT, but she's all about like the pelvic floor, all about the pelvic floor and sleeping on like your stomach at a perfect angle that helps to release and stretch your fascia is some interesting things that I've seen. But there's been quite a few perspectives on the fascia from people that are focused on plantar fasciitis or myofunctional or pelvic floor health, just different aspects of the fascia. And I just feel like I don't remember learning anything about fascia in A&P.
No, we didn't. We've probably seen that dissection of the frontal line of fascia that goes like tongue to toes.
Yes.
And it is fun getting to talk to some of like my physical therapist friends who are into pelvic floor stuff, because it's like there are these connections even with the tongue and whatever that I can't fully explain, but it's definitely there. And it's I'm just always wanting to learn more about the fascia. How it's connected, because it's just so cool, the things that
It's
come back.
fascinating.
It is, oh, look at you go. Add it to the list.
It's been a week.
Amanda, you have to watch Kristen's. She has some of the best Instagram posts where there's a whole group of them that are wearing their CPAP machines, and they're like, it's across the nation of them just like saying goodnight to each other with their. You have to follow her. I would, if I lived in New York, I would work for. I would work for you.
I know. I'm like, just kidding.
It was so funny. My friend, one time, this was like before we were like actually good friends, and she was like, who's your boss that lets you just be like running through the hallway at your office, like doing weird videos? And I was like, oh,
I am the boss.
And my team just puts up with it, and it is what it is. And our patients get a kick out of it. The fact that you're in a dental office, just like hearing laughter instead of
it's relevant. Yeah, it's not stuffy. I love that medicine and dentistry is starting to move away from like the stuffy, like old boy, good old boy club kind of thing. And it's no, you are in control of your health. You can absolutely intervene. You are capable. You don't have to have this doctor writing you a prescription to be healthy or a dentist drilling on your teeth to be healthy. Like, I think health is changing paradigms big time.
Yeah.
Slowly, but it's getting there.
We're becoming less of tooth mechanics. Slowly.
Yeah. We're hoping to become less tooth scrapers. So
slowly. I'm like, trust me, I don't want to do more fillings. I actually want you to be cavity free because I like don't want to do this. So can we please stop?
Yeah, no dentist ever loves doing fillings. Like it's life sucking. So
awesome. So I mentioned your Instagram. Where else can we find you?
That's probably the easiest. Prana with Dr. Kristen. And I'm for local people. I'm in upstate New York near Albany, Lysenko Dental. I can tag or we can put like my website or whatever, but I'll see people locally for tongue ties, adult sleep apnea therapy. Sometimes if somebody's, I listened to your podcast and I don't know where to begin, just shoot me a message. We can at least try to direct you to the right spot. And a lot of it's just like having a network of people to collaborate with. I have some free stuff, like a download of just kind of some things to look for. If you're a professional, where to send somebody for a sleep test, what are the signs? So if you're like, oh, where do I begin? There's some free stuff there.
Cool.
I need to connect with you so I can put all that stuff in my saliva
I
sleep
know.
referral stuff.
Gotcha.
Trying to get a bank in saliva sleuths so that we have like myofunctional therapists, and that's
Yeah.
where Julia and I have connected a little bit too.
Hard on that.
Yes.
So I'm sure she's got a good list going.
Yeah. Yep. Julia with UARS Wellness.
Yes,
That's who we're talking about.
Parents need to follow her, because if you just don't know where to begin with your kid, she literally, that's like what she does, is guides parents with creating a care team and just like figuring out next steps.
Yeah.
Which is like amazing.
Yeah.
Hmm.
Yep. She's awesome. She's a good connection to have. So you focus more on adults. She is the kiddos.
Yep.
Her mission is catching it little and supporting families and finding the right resources when we can identify it when we have the littles and get them started so we don't have sleep apnea as an adult.
Yeah. And if there's any dentists that like want to learn this stuff, I'm hosting my second retreat for dentists. It's a wellness retreat
Cool.
for dentists, but also it's 12 CE credits on airway and sleep. If you're a hygienist, you can come if you bring your dentist. We had that last year. We did have one hygienist join us, which was really cool. But it's like yoga, wellness, breath work, and then let's learn stuff, but not in a cold like conference room. Let's learn.
Not sitting on your butt for 8 hours.
It's like very non-traditional, but it's a lot of fun.
What
That's
if we
super cool.
don't have a dentist?
We could try to figure something out.
What if
We're trying to like not have it just be like open to hygienists. Like once we open the floodgates, and like a lot of the curriculum you might find like boring for like oral appliance therapy. So
Not me.
you wouldn't.
Mm. Sounds like you need a second retreat for hygienists and
Maybe.
omit that portion.
Maybe.
Or include it so we understand. I think
Yeah.
Brian someone asked me a question on the nitric oxide score for Bristol, and he kind of gave me a really simple answer, and I was like, yeah, I'm gonna need the deep dive. Sure. So then I put in what he gave me and then ChatGPT'd it, and I was like, give me the research on all of this. And then I was like, yes, this is the deep dive I needed. I gotta understand it in and out and sideways so that I can explain it to anyone and everybody.
Yeah.
Yeah. Perfect.
Kristen,
Awesome.
thank you so much for your time. This was a lot of fun, a great conversation, really great questions. Thank you for not being afraid to get kicked out of study clubs and asking good questions. Your patients are very lucky to have you. New York is lucky to have you.
Yeah. And then send us your retreat information this weekend.
I could figure out. I could see if I could do like a discount.
Perfect. See? All right. Thank you.
Thank you.